Namaskar. Myself Dr. Narayan Shahane, Consulting Ayurvedic Urologist, Brahma Ayurveda Multi-Speciality Hospital Research and Academic Center, Nadia, Gujarat, India, which is the world's first and only Ayurvedic Urology Center. In this video, we are going to discuss regarding the role of Panchakarma in the management of different urological conditions. So basically, to understand this concept, first of all, we need to understand the exact functioning or physiology of urination or the functioning of the bladder. So basically, bladder is a bag made up of a muscle. The name of that muscle is detrusor muscle. So normally, unless and until almost 400 to 500 ml of urine is collected in the bladder, we are unaware of that. And once that much quantity gets collected, we get the urge to pee. As soon as we go to the washroom, two things occur simultaneously. The bladder, a bag which is made up of that muscle detrusor, this detrusor muscle, the urine bag, contracts. At the same time, there is a sphincter just at the base of the bladder, a wall with which we have control on our urine. That wall relaxes. So the contraction of the detrusor muscle and relaxation of the wall, which is called as sphincter, occurs simultaneously and the flow of urine starts. This is called as detrusor sphincter synergia. So they act synergistically. Means as soon as the detrusor contracts, the sphincter relaxes and the flow of urine starts. Detrusor sphincter synergia. This is what it normally occurs, and the flow of urine starts and bladder gets empty. It's a very easy process. Normally, whenever we get the urge to pee, we just go and come back and bladder is empty and we are back to work. Now, according to Ayurveda, there is a concept of energy which is called as Apan Vayu. Apan Vayu is an energy which is responsible for 5 important functions in human body. And these are very clearly explained in the classical text of Ayurveda. So this is the energy which governs 5 important functions in human body. These are it governs the physiology of urination, defecation, ejaculation, menstruation and pregnancy. So basically, the same energy is responsible for holding all these 5 things up to a certain limit. And once that limit is attained, the same energy expels them out. In fact, the same energy gives us the urge or sensation. It's like the way we were discussing regarding urine, that unless and until almost 400 to 500 ml of urine is collected in the bladder, we are unaware of that. That means this energy Apan Vayu is holding urine inside the bladder up to that limit, and once that limit is attained, the same energy gives us the urge. As soon as we go to the washroom, the same energy expels it out with ease, without efforts. Same with defecation. This energy Apan Vayu holds feces or fecal matter or stools inside our intestine for almost 24 hours. And once that limit is attained, the same energy gives us the urge. And just remember, whenever we get a proper bowel evacuation, it never takes more than 2 minutes. So it's very easy. So same energy expels it out with ease. Now, same with ejaculation. While having the sexual activity, the semen is held by this energy up to certain limit. Once that limit is attained, the same energy expels it out with force. Same with menstruation. The innermost layer of the uterus, that means endometrium, is held by this energy for almost 28 days. And once that limit is attained, the same energy sheds it off in the form of menstrual bleeding. Same with pregnancy. The fetus is held by this energy for almost 9 months. And once that limit is attained, the same energy Apan Vayu induces labor pains and the process of labor or delivery starts and delivery occurs. So the same energy is responsible for holding all the 5 things up to a certain limit. The same energy gives us the urge and same energy expels them out. So obviously it's a very crucial energy which works with certain sensors. There are many conditions in which, urological conditions in which this energy is badly disturbed. Say, for example, bladder outlet obstruction. In this, the bladder is unable to evacuate the urine properly. That means there is obstruction. There is one more condition called as interstitial cystitis or hyper or overactive bladder. In this, the bladder is unable to hold the urine. Means in both conditions this energy is disturbed. Now obviously, while addressing or treating or managing such conditions, Panchakarma along with Uttar Basti is really very crucial. Now Panchakarma, we already discussed regarding Panchakarma in our other video. So for more details you can refer that video. But here, out of Panchakarma, out of 5 procedures to restore or to rechannelize this energy upon Vayu, the best treatment is Basti. Basti is the best treatment of choice to correct, to rechannelize, to reset this upon Vayu energy. Now what is Basti? Basti, in this certain medicines are introduced through the anus, through the back passage into the intestines. There are basically 2 types of Basti which are commonly practiced in the field of Ayurvedic urology. In fact, the course starts with the night Basti. In this, an oil-based medicine is used. That oil-based medicine is introduced through the anus, through the back passage, using a very soft and delicate rubber tube which is thinner than this, which is properly lubricated, absolutely neat and clean. Hardly 2 to 3 inches of that tube is introduced into the anus, and then that oil-based medicine, the night Basti is having oil-based medicine. That oil-based medicine is introduced into the intestine. Now that medicine stays inside the intestines overnight. In fact, it is initially a detox medicine. It stays inside the intestines overnight. It spreads all over the intestine, and next morning that person passes motions better than the normal day. So this is the night Basti. Now after that, maybe after a couple of days, we start the morning Basti. Now the dose of that night Basti medicine, oil-based medicine, is only 60 ml. We may increase the dose later if it is necessary. Now once we start the morning Basti, now this night Basti is given just after the dinner at bedtime. The morning Basti, it is given empty stomach. Now the dose of that morning Basti is generally around 1 liter, but generally we start with a smaller dose, maybe around 500 ml, then we gradually increase the dose to 1 liter. Now it's a combination of decoction of certain herbs, certain oil-based medicines, certain salts and honey. Now this medicine, again with the same tube into the anus, the medicine goes inside the intestines, but it won't stay inside. The night Basti medicine, that stays inside the intestines overnight, but the morning Basti medicine, it stays there hardly 15-20 minutes. So whatever the waste and toxins, they are separated by the night medicines, because the night medicine, the effect of that medicine spreads all over the body. Whatever the waste and toxins, they are stuck to the body, they are gradually separated and brought to the intestines, so that everything is sucked and that medicine for morning Basti flushed out. So that person has to go to washroom maybe twice, thrice in the morning only, then during day it is fine. Now this is how the morning and evening Basti continues. Now initially it may take 3, 5 or 7 days to achieve a proper detox. Once the detox is achieved, the Basti continues, but the medicines are different. Once we achieve a proper level of detox, then we replace the detox medicines with strengthening medicines, because at the same time we need to strengthen the system. Basically the treatment of Ayurveda is always in 2 parts. The first part is Vyadhi Vishesh Chikitsa, specific disease treatment, and the second part is Apunarbho Chikitsa, means the treatment to prevent the recurrence. In this we need to strengthen the whole system in such a way that the disease should not recur. So that part is there. So this is how the Basti continues. Obviously whenever we plan Panchakarma detox for anybody, we need to prepare that person's body for that detox. So whenever we plan Basti, obviously we need to prepare that person's body, and for that, for the preparation, there are 3 procedures which include Abhyanga and Svedana. Abhyanga is classical therapeutic massage with certain oil-based medicine. So it is whole body massage followed by steam. Obviously steam is also medicated. So this is how the Abhyanga, Sedan, the night Basti called as Anuvasan Basti, the morning Basti called as Niro Basti, is used to rechannelize or to reset or correct the functioning of that energy called as Apanvayu. This is how it is used in the practice of urology. Hope this clarified the use of Panchakarma in urology. Thank you. See you in our next video. Take care. Bye-bye.